because it's a non-contact injury, that means it has to be related to the internal function of the body, to neuromuscular control, muscular contraction patterns. So that's what we started looking at. And we published kind of a seminal paper in the American Journal of Sports Medicine, one of the first to look at this issue in 1996, where we basically showed dominance patterns were different in males and females. So basically, we characterized in that paper and many others that followed it 4 dominance patterns that we found not only in just female athletes compared to male athletes, so this was the case, but also it turned out athletes that were at high risk of a non-contact injury showed these same imbalances regardless of whether they were male or female. So the first imbalance we showed is what we called ligament dominance. And what I mean by that is, instead of using the musculature to absorb and dissipate force from the ground to the knee joint, allowing that force to go to the ligament and allowing the ligament to control and dissipate force. Well, muscles, especially sagittal plane muscles, calf flexors, extensors, knee flexor, extensor, hip flexor, extensor, trunk, those are designed, especially in the sagittal plane, to control and dissipate force. Whereas ligaments, you put too much force on a ligament and it's going to rupture. So that's what we term a ligament dominant individual, and we can talk in more detail about what that is characterized by in athletes. The second imbalance is related, though it's different, and that's quadriceps dominance. Athletes who are going to go on to a subsequent ACL injury, whether they're male or female, tend to be quadriceps dominant. They tend to be very front loaded. And what I mean by that is, in order to absorb and dissipate force at the knee, when they do activate their musculature, they primarily activate the quadriceps. Now, the quadriceps is a very powerful muscle at the front of your thigh, and it is good at absorbing and dissipating force. There are problems, though, in being quadriceps dominant and not posterior chain dominant, which is the opposite of that pattern, in that when you're landing, so if this is my knee joint, tibia, this is my fibula, femur, and you contract your quadriceps, what you're doing is extending the knee. And because of the geometry of the knee, so the medial, well, I'm sorry, this would be the lateral, this is my fibula, lateral tibial plateau is convex, as is the lateral femoral condyle. Whereas on the medial side, the medial tibial plateau is actually concave, and the convex medial femoral condyle fits into it well. But when the knee's near full extension and your quadriceps dominant, you contract the quadriceps primarily to stabilize the knee. It does bring the joint together. It does stiffen the joint. But because of the geometry of the knee, what it causes is this combination of rotation, especially internal rotation, and that because you have this convex to concave interaction on the medial side, that's the pivot point. Well, what happens is, not only does the tibia rotate in, it actually distally goes out and comes forward. Well, that's a problem because that stresses the anterior cruciate ligament. It puts strain on the anterior cruciate ligament. So quadriceps dominance is a pattern that increases risk of high strain and ACL rupture. The third dominance pattern that we observed in women compared to men, and in athletes who were relatively high risk of injury, was what we called leg dominance. Now, all athletes are leg dominant, but what you see in those athletes who are going to go on to an injury is they have different dominance patterns and a lot of difference in force dissipation, strength, neuromotor activation on one leg versus the other. They favor one leg over the other. And what you see is, for example, asymmetry side to side in quadriceps peak torque, but more importantly, in hamstrings peak torque, side to side. And you see big differences in relative hamstring to quadriceps activation side to side, big leg dominance patterns in that. So leg dominant individuals tend to be at greater risk of non-contact ACL injury. And the final neuromuscular imbalance that we found and reported on was what we call trunk dominance. The way you observe that in athletes, or an athlete who's at relatively high risk, is the trunk during landing and cutting movements. The trunk moves a lot around relative to the plantar surface of the foot, where the foot is planted. So if I'm planted on my left foot, the trunk tends to move over that left hip and knee. So you get a lot of frontal plane trunk motion, but especially to the side of the planted foot. What that leads to is high ground reaction forces that come lateral to the center of the knee and hip joint and cave those joints inward, which leads to this valgus mechanism.